Hello and welcome to my channel. In this video, I'm going to talk about cerebral circulation. So when we talk about the cerebral circulation, we must know there is an anterior circulation and a posterior circulation. Anterior circulation supplying the anterior parts of the brain and the posterior circulation supplying the posterior region of the brain. And anterior circulation mainly includes the carotid artery system, which comes from the internal carotid artery mainly. And the posterior circulation includes vertebrobasilar system, which comes from the vertebral artery and the basilar artery. So the rate of the blood flow of cerebral circulation is around 750 ml per minute, and also it is 15% of the complete cardiac output. So arterial circulation has two regions. Anterior circulation comes from the carotid system via the internal carotid artery, and it gives off four regions or four branches: the anterior cerebral, middle cerebral, ophthalmic, anterior choroidal. And the posterior circulation comes from the vertebrobasilar system, which includes the vertebral artery and the basilar arteries. And in between these anterior and posterior circulation, there are also the communicating arteries, the anterior and the posterior communicating arteries, which together along with the anterior and the posterior circulation form a ring-like structure in the brain, which is known as circle of Willis. This is the ring-like structure between the anterior and the posterior supply of the brain, which is known as the circle of Willis. So talking about the anterior circulation now, which comes mainly from the internal carotid artery. So we know the internal carotid artery comes from the common carotid artery. Over here we can see the common carotid artery giving off the internal and the external carotid artery branches. So the branches of the common carotid arteries bifurcate into internal and external carotids at the level of the carotid sinus. In this picture, we can see the common carotid giving off the internal and the external branches at the region of the carotid sinus. And as we know already from the previous video of the cavernous sinus, that the carotid artery, internal carotid artery, enters via the carotid canal into the brain to contribute to the circulation, and it also enters into the cavernous sinus and comes out of the cavernous sinus and contribute to the circulation, arterial circulation of the cerebrum. So it has regions throughout its course. So there is the cervical region, petrous region, cavernous region, and the cerebral, finally the cerebral part. So as we know that the carotid artery travels via the carotid canal in the petrous part of the temporal bone. So this creates the petrous part, which is seen at the temporal bone. And from there it enters the cavernous sinus and comes out of the cavernous sinus as the cerebral part and gives off arteries or branches like the middle cerebral, anterior choroidal, posterior communicating, and ophthalmic artery. In these pictures, we can clearly see the internal carotid artery piercing through the cavernous sinus and coming out of the cavernous sinus as the to continue as the cerebral part of the carotid artery. The exit of the carotid artery through the cavernous sinus. Even in this picture, we can see the internal carotid artery. Over here as well, the cavernous sinus and the internal carotid artery, the cavernous part of the internal carotid artery. So it enters the skull through the carotid canal in the petrous part of the temporal bone, and the internal carotid artery supplies the orbit, pituitary gland, frontal, parietal, temporal lobes of the cerebral hemisphere. An external carotid artery is responsible for the blood supply to the superficial and the deep muscles of the face and the neck. So these are in this picture we can see the common carotid artery, which bifurcates into external carotid artery, and the internal carotid artery. And these are the branches of the external carotid artery which supply the superficial and the deep regions of the face and neck. And here is a small mnemonic, a VIP is coma for the branches of the internal carotid artery, which include mainly the anterior cerebral, middle cerebral, which supplies the middle region of the cerebrum. Over here, this is the anterior cerebral artery, the ophthalmic artery, and the communicating artery. Even in this picture, we can see the internal carotid artery coming out of the cavernous sinus and giving off the branches. So now, talking about the posterior circulation. So posterior circulation includes the vertebral artery and basilar artery, which includes other branches like the anterior inferior cerebellar, posterior inferior cerebellar artery, posterior cerebral, pontine artery, superior cerebellar artery. So talking about the region or the origin of the vertebral arteries. So the vertebral arteries are given off by the subclavian artery. So the subclavian artery on the either side give rise to the vertebral arteries which fuse and form the basilar artery. So these vertebral arteries travel all the way in the foramina of the transverse process of the vertebra, the cervical vertebra. Over here we can see the vertebral artery which is traveling through the foramen present in the transverse process of these vertebrae, and then it reaches and it travels all the way to form the basilar artery. So these are the vertebral arteries which fuse together, form the basilar artery, and supplies the posterior regions of the brain. So in this picture we can see the anterior circulation and the posterior circulation, and also the circle of Willis. Anterior circulation, which includes internal carotid artery, which gives off branches, the anterior cerebral, anterior communicating, middle cerebral artery, which supply the anterior parts of the brain. Here we can see the anterior cerebral artery, middle cerebral artery, posterior communicating artery. These all are the branches of the internal carotid artery. And the posterior circulation, which mainly include the vertebral and the basilar artery, which gives the branches like superior cerebral artery, posterior inferior cerebellar, anterior inferior cerebellar, pontine arteries, and many other arteries that we'll see later, and supplying the posterior regions of the brain. So here we can see vertebral arteries given off by the two subclavian artery, and they also form the anterior spinal artery, which has a major contribution in the spinal circulation. So talking about the branches, now we know that the anterior spinal artery is a branch given off by the vertebral arteries, and the vertebral arteries are from the subclavian arteries on the either side. They give off vertebral arteries which travel all the way along to form the basilar artery, travel through the foramina present in the transverse process of the vertebra, cervical vertebra, and then they form the basilar artery. And the basilar artery gives off branches like the posterior cerebral, superior cerebellar, anterior inferior cerebellar artery, or the ICA, posterior inferior cerebellar artery, which is also known as pica, and pontine arteries on the other side of the pons. So talking about the posterior cerebral artery, talking about this artery, So this artery, posterior cerebral artery, is seen at the place where there is the intersection of the posterior communicating artery and the basilar artery. So at the place where the basilar artery intersects or comes in contact with the posterior communicating artery, at that point we can see the posterior cerebral artery. So the posterior cerebral artery supplies the occipital lobe of the cerebrum, and it arises near the intersection of the basilar and the posterior communicating artery, and it gives off branches which are the ganglionic and cortical, and supplies the midbrain, thalamus, internal capsule, choroid plexus, cerebral peduncle, occipital and temporal lobe. So here we can see, so in this picture we can see the posterior cerebral artery supplying the regions of the midbrain, medial, anterior and lateral parts of the thalamus, temporal lobe and occipital lobe. So in this picture we can see the posterior cerebral artery giving off the branches serving which supply the temporal regions, occipital regions and the other regions like the thalamus. Giving off the posterior, in this picture as well we can see the posterior cerebral artery giving off the branches which supply the occipital region, parieto-occipital branch, posterior temporal branches supplying the temporal part of the brain, and anterior temporal branches supplying the anterior temporal region. So now talking about the superior cerebellar artery. So this artery is seen at the place where the basilar artery terminates, superior cerebellar artery. Where the basilar artery comes to terminate, this is superior cerebellar artery arises. It arises near the termination of the basilar artery and passes laterally below the cranial nerve 3. Over here we can see the presence of the oculomotor nerve. So it passes laterally below the oculomotor nerve of the cranial nerve 3. Supplies the superior medial lateral parts of the cerebellar cortex and the nuclei, which are the parts of the gray matter in the brain, and also supplies the part of the midbrain. So over here we can see the superior cerebellar artery near the termination of the basilar artery, which is present laterally, which is present or seen lateral to the lateral and below the oculomotor nerve. And in this picture as well, we can see the superior cerebellar artery at the termination of basilar artery. So now talking about the anterior inferior cerebellar artery. So it's one of the three pairs of the arteries which supplies the cerebellum and arises from the basilar artery on the either side at the junction of the medulla oblongata and pons. So anterior inferior cerebellar artery is seen at the junction of the medulla oblongata and pons over here on the either side. And in this picture as well, we can locate the anterior inferior cerebellar artery at the point where the pons and the medulla oblongata, at the junction of the pons and the medulla oblongata, and it gives branches like the internal auditory and the labyrinthine artery. And in this picture we can see the branches of the anterior inferior cerebellar artery, which is the labyrinthine artery. So the posterior inferior cerebellar artery or the pica, it winds backwards around the upper part of the medulla oblongata and passes between the origins of the vagus nerve and accessory nerve, and finally reaches the cerebellar peduncle. And on the undersurface of the cerebellum, it divides into two branches, which are the Vermian medial branch, or the tonsillar hemispheric, or the lateral branch. So here we can see the course of pica, posterior inferior cerebellar artery, which winds, travels backwards, and almost at the undersurface of the cerebellum, or to the inferior part of the cerebellar peduncle. It gives off the branches. In this picture, it's more clear. It reaches all the way up to the cerebellar peduncle and gives off the branches, which are the tonsillary branch and the Vermian branch. And in this picture as well, we can see the anterior inferior cerebellar artery and the posterior inferior cerebellar artery traveling backwards to the cerebellar peduncle and giving off the cortical branches, tonsillar branches. Over here as well, we can see though it gives off segments, the posterior inferior cerebellar segments, the tonsillary segments, and the Vermian segments. On the pontine arteries. So pontine arteries are a pair of blood vessels present on the either side of the pons. Present at the right angles from the basilar artery, supply the pons and adjacent parts of the brain, and they give off the branches like the paramedian branches, short, long circumflex, and the paramedian short circumflex branches and the median branches. So over here we can see the pontine arteries on the either side of the pons. Over here as well we can locate the pontine arteries. And in this picture as well, we can see the pontine arteries at the right angles. And in this picture, we can see anterior inferior cerebellar artery with the segments which supply the anterior pons, lateral pons, flocculo-peduncular segments, which is a gray matter region in the cerebellum, which is a gray matter region in the brain, and also giving off the cortical segments, and the posterior inferior cerebellar artery giving off 5 segments, which include the tonsillary segments and cortical segments. And this is the superior cerebellar artery giving off the segments which give the cortical, pontomesencephalic, mesencephalic, cerebromesencephalic segment. And over here as well we can see the posterior inferior cerebellar artery and the anterior inferior cerebellar artery giving off the cortical segments. And the flocculo-peduncular segment. These are the cortical segments, flocculo-peduncular segments, supplying the flocculonodular nucleus, and flocculo-peduncular segments by the posterior inferior cerebellar artery. So talking about the posterior communicating artery, it is present at the base of the brain and forms a part of the circle of Willis. So it connects the 3 cerebral arteries. So anteriorly it connects the internal carotid and the middle cerebral artery. Posteriorly it connects the posterior cerebral. So these are the 3 arteries that the posterior communicating artery connects to form the circle of Willis. Anteriorly and posteriorly. And the posterior communicating artery supplies the deeper structures of the brain, gives off small branches, which are the posterior-medial central arteries. Over here we can see the anterior communicating artery giving of the anterior medial group of the central arteries, and the posterior communicating arteries on this side and this side, giving of the posterior medial group of central arteries, which connects the internal carotid artery. This is the internal carotid artery. Anteriorly, it connects the internal carotid artery and the middle cerebral artery. This is the middle cerebral artery. It connects the posterior cerebral artery posteriorly to form the circle of Willis. So here we can identify almost all the arteries. The vertebral arteries fuse and form the basilar artery. Basilar artery giving off branches like the posterior cerebral artery, pontine arteries, anterior inferior cerebellar artery, posterior inferior cerebellar arteries, and the posterior communicating artery. And from the anterior circulation, we have the internal carotid artery, which gives off the branches like middle cerebral artery, anterior communicating artery, ophthalmic artery, and the anterior communicating and the posterior communicating, which form the circle of Willis. So here we can see the circle of Willis formed by the anterior communicating artery and the posterior communicating arteries. Over here in this picture, from this picture we can almost revise all the arteries: the vertebral artery, basilar artery, pontine arteries, anterior inferior cerebellar artery giving off the labyrinthine artery or the internal auditory artery, posterior inferior cerebellar artery, superior cerebellar artery, posterior cerebral artery, and the posterior communicating arteries, which form a connection between the posterior cerebral artery and the internal carotid artery and the middle cerebral artery, and gives off the posterior medial central arteries and the anterior medial central arteries. So the circle of Willis is a ring of vessels which connects the anterior and the posterior circulations of the brain. So this is the anterior circulation, including the internal carotid artery. This is the vertebrobasilar system, giving off the posterior circulation. So this was about the cerebral circulation or the blood supply to the brain. I hope you like this video.